Good afternoon, everyone. Welcome to GSS Score. This is Ajesh, and in our series of pathways today, we have one of the rankers of UPSC 2019. That is Dr. Asrar Ahmad, who has secured All India rank 248 in UPSC 2019. By qualification, he is basically an MBBS, and he has qualified UPSC with medical science as an option. And he is here with us to share all of his success journey, his mistakes, what he has learned in this journey. And he is also from Kashmir, so the people from Kashmir, they can also get some inspiration from it. So Dr. Asrar Ahmad, first of all, many congratulations and welcome to the platform of GSS Score.
Thank you very much, sir.
Yeah, so Asrar, can we just know what was your source of motivation? How did you enter into this examination of UPSC?
Sir, I started my journey way back in 2016. After I completed my final year of MBBS, there were many different factors of motivation. One of the prime reasons was when I was doing my final year, as well as during my initial phase of internship, I saw that healthcare cannot be addressed by just the clinical aspect of it. So there are many difficulties as we were in touch with a lot of people who are coming to hospitals. So there are a lot of other aspects around the healthcare which need to be addressed, like electricity, transportation, etc. Many people, they did not have even the basic awareness about many of the things. So that was something which motivated me towards opting for a career where I can make a little difference to such situations. And there were other motivating factors as well. I wanted to learn a lot of other subjects too. During my MBBS course, I was not able to give focus on any other subject other than the medicine. So I wanted to learn other aspects like geography, current affairs, etc. And moreover, my family has been a source of motivation. They never compelled me towards civil services. However, if I look back at my grandfather, my paternal grandfather, he came from a very humble background, and he became a teacher even before the independence. And he used to teach other people. So education was very important. My maternal grandfather, he was an officer. So he had also started his journey from very humble background. So education has been around for long. That was something which I wanted to continue. So this civil service, it provides a platform where you can study a lot of different things and make a change in the society as well.
Okay, thank you, Asrar. So, Asrar, how did you develop this deep interest in the subject of humanities? When was it?
Sir, it was in my internship. After I completed my final year papers, it was after that that I decided to appear for civil service examination.
Okay, fine. So, Asrar, we have seen that the majority of the people who are from medical background, they go for optional like humanities, sociology, political science, etc. And there are very rare examples when a doctor take medical science as an optional. Fine. So, what was your criteria for choosing this medical science as an optional?
Sir, the major reason was when I was doing my MBBS, I wanted to go and do post graduation. So I had studied my subjects thoroughly because I was not into civil services. So that was something which was like a natural progression. I had studied my subjects well. So it was easy for me, and I did not look for many other options. So I straight away went for medical science.
So Asrar, you have qualified UPSC in your third attempt. So what went wrong in the previous two attempts, and what was your area of improvement? How did you cope up with this all?
Sir, in my first two attempts, I could not clear the preliminary examination. So this is the first time I could clear the pre-examination. In the first attempt itself, I was not very well prepared. So that was something which was an issue with me. However, in the second attempt, my level of preparation was similar to the third attempt. But the major thing that was missing was confidence. When I appeared for the examination, I was very scared. I could not manage the time, and I had put 17 questions for review, and I could not attend towards the end. I could not manage the time well. So this time around, I boosted my confidence, and I did a lot of other readings. I revised the books multiple times. I had already covered a lot of topics in the second attempt. And moreover, my main focus was on optional as well as on the main subjects, because pre was something which was preventing me from writing the mains. So I was, in my first two attempts, I was also preparing for mains examination, the answer writing and other things as well. So once the pre cleared, so I was pretty confident that I could perform well in mains as well.
Okay, so Asrar's majority of the people who fail in UPSC prelims examination, they have a dilemma that whether I should go for prelims or whether I should focus for mains. How did you deal with this dilemma?
Sir, in my opinion, mains and prelims, most of the subjects are common, so it should be an integrated preparation, be it for current affairs, be it for geography, history, etc. So my main focus was the areas which are common to both prelims as well as mains. I focused on those areas from prelims as well as main point of view. Uh, and I try to revise them multiple times. For instance, before my prelims examination in this attempt, I had prepared a sort of notes of modern history in around 40 to 50 pages, and I revised that multiple times. And after my prelims, I just had to revise the whole notes for half a day itself, and it was very, very beneficial for the mains too. And for current affairs, I had segregated my notes. For instance, we have monthly current affair booklets. So I had written the main points out of it in separate sheets, and for the prelims I had just marked on the booklet. So it needs to be a very integrated approach.
Okay, fine. Asrar, for the last few years, many people from Kashmir, they are doing wonder in UPSC. So do you think that such kind of results boost confidence in the people?
It surely does, sir. Very few people used to come into civil services from Jammu and Kashmir. However, the trend has now changed, especially after 2008 when Shahid Iqbal sir came, when Shah Faisal sir came. After that, a lot of people are now coming into civil services. This year from Jammu and Kashmir and Ladakh combined, around 16 people have cleared this exam. So before 2008, we had a perception in Jammu and Kashmir that people who clear this examination, they are some different kind of people. So you need to be very special to clear this exam. However, it is an exam which any person can clear. You just need hard work. The one thing which has surely improved is creation of new role models. We saw Asrar Ahmad sir and a lot of other people. Like last year only, Miss Rehana Bashir, she also cleared this examination. She is an IAS probationer now, and she was from the medical background, which gave me, and she has been a sort of role model, and which gives a confidence to many people like me that we can also clear this exam.
Okay, fine, Asrar. Asrar will not talk about the option of medical science, fine. So can you just very briefly explain this? What exactly is the syllabus of this medical science option in very brief manner?
So syllabus is more or less whatever we have covered during our graduation. So most of the subjects we have covered well during the graduation, and the syllabus is selected. We do not have to revise all of the things that we have covered in graduation. However, still the syllabus is very huge. I still remember I gave a lot of months before my prelims examination for a dedicated preparation for the optional subject only. And after my prelims, I gave around 2/3 of my time to optional. So there is a lot to revise. So more time needs to be given. However, the subjects, the basic subjects, they can be covered from easily from the standard textbooks that people used to read during the graduation. And some of the notes are easily available. I have personally, especially for my first prof subjects, I read some of the notes written by Dr. Parikshit. They have been very helpful in he has very beautifully compiled the notes from different books. So these are the basic sources, but one needs to be very focused to syllabus. Some of the questions come out of syllabus. However, if people have covered all the topics that are covered in syllabus, the person is going to score well in the optional subject.
Okay, so is it possible to synchronize the syllabus of your graduation during MBBS along with this UPSC? Is it right?
Yes, sir. It is very possible if a person is doing his or her graduation, and if he's thinking of preparing for civil services, I think he should focus on the syllabus part of the CSE, so that those topics can be covered very well and notes can be made during the graduation itself, which will prove to be very beneficial, and these notes can help in reducing the time that would be given to the optional subject, which is going to improve the overall marks in the GS, because not enough time is left for GS when medical science optional is to be covered.
Okay. And for example, in other of the subjects, for example, in political science or sociology, the syllabus of UPSC that goes up to the level of MA, fine. So is it the same case for this medical science also?
Sir, in few of the subjects, some of the topics, they were not covered in our graduation. However, most of the topics are well covered in a graduation and can be easily covered if a person starts the preparation in graduation itself.
Okay, okay.
Nothing
So,
special needs to be done.
okay, Asra, do you feel that there is any spillover effect of MBBS, this medical science option, on other subjects of UPSC, like GS and all?
Sir, sometimes it has a spillover effect because none of the part of medical science optional is except for some of the there is one subject PSM. Some of the topics they overlap with GS portion. However, most of the topic, more than 99% of the syllabus, it does not coincide with the GS part. So a lot of extra time is needs to be given to medical science. So that is something which bothers some people. It personally bothered me because the time that I was giving to optional subject, I had to leave the GS subjects altogether that time. So there is an issue. However, the people have covered these subjects during their graduation. So that is going to give them an edge in the end.
Okay. So Asrar, anyone from any educational background, like someone who is an engineer or someone who is a BA, can he think for medical science as an optional?
So I would not recommend such people.
Okay.
Some of the people coming from BDS background, even they have asked me about keeping medical science optional as their optional. It is up to them. It can be one of the choices. However, I would strongly not recommend them to go for medical science because there are a lot of subjects which they would not have covered, and especially people from non-medical background. I think my strong recommendation would be not to go for medical science because it is a huge subject and you need to have some sort of background to go for it.
So this is a subject in which exclusively that can be reserved only for the people who are from MBBS background, right?
In my opinion, yes.
Yeah, and that's fine. Asra, tell me one thing. Whenever we choose any optional, any of the options, then one thing that comes into our mind that there should be standard books, there should be standard test series, there should be standard teachers. But we have seen that such options like medical science or engineering, they lack in this area. So how did you deal with this kind of issue?
Sir, it was a difficult thing for me initially because there are hardly one or two test series available in the market and their evaluation is not at par with other subjects. So I did not personally go for any coaching or any test series for my optional subject. I focused on my personal notes, which I had prepared during my graduation for the prof examinations. And I went through the standard books as well as for the notes that were prepared by some of the seniors like Dr. Parikshit. That was my standard thing. The only thing that I did extra, that was writing answers. I had one of my friends who was also preparing for the civil services, and he also appeared in the interview this time. So writing answers daily, especially after the prelims, that helps in increasing the speed and improving the overall structure of the answer writing structure. But test series is something which I would not recommend. If you write the answers daily, that is beneficial, and coaching would not be required if you have covered the subjects well during your graduation.
Is this option medical science like mathematics where someone can score 10 out of 10 in some of the questions?
So I don't think so because I have hardly seen a few people who score more than 300 marks in medical science option. So I don't think marking is like that, and it is a secret how UPSC checks the papers. So okay. Scoring above 300 is very difficult in medical science. Okay. So I'm not aware about the exact marking.
Okay. And Asra, tell me one thing. In any of the answer, we have two things. First is content, and second is the style of writing. So, what is the proportion of content and the style of writing in this medical science paper?
Sir, in medical science, unlike GS, focus is more on the content rather than the answer writing. The one thing that makes the answer writing easier for medical sciences, we can easily write the answers in flowcharts and diagrams. For instance, for anatomy subject, a person can very well explain the answer in a diagram format and coloring the diagram and write just few lines to substantiate the diagram. And for other subjects, a simple flowchart can be made, which saves a lot of time and which presents a very good answer. So that is something which is beneficial in medical science.
Okay. So is there something like notes making in this medical science option?
Yes, sir. There are some topics which are overlapping in different subjects. So I would recommend to make notes of those topics. For instance, HIV/AIDS, tuberculosis, etc. These are spread over multiple subjects. So if a person has made consolidated notes, it is going to be beneficial. And some of the subjects like anatomy, biochemistry, etc. If notes are there with the person, it is going to shorten the amount of time required for the revision, which is going to be very beneficial, especially towards the end of mains preparation when the exam is approaching.
Okay. Asrar, do we have any dynamism in this paper? Like in all the subjects, we have some dynamism. Like, do you people have to view all the current affairs in the field of medical science, technology, and all?
Yes, sir. Some of the questions, most of the questions are from the static area itself. However, there are some areas. This year, the paper 2, that had some of the dynamic questions, which was not expected. For instance, last year, one of the questions was on Mission Indradhanush. So that is something which we have covered during in our GS itself. So there are some of the topics which are covered in the GS, and there is a little level of dynamism. However, most of the topics are from the static part.
Okay, okay. So do we have any specific magazine or journal that has to be read for this medical science optional?
I don't think any magazine or journal is required for it. The standard books that people have read during the graduation, they are more than sufficient.
Okay, so the best part of this option is that the syllabus is more or less static. So that this is the best part. Fine.
This is the best part.
Yeah. Asrar, tell me one thing. Whenever people go for any kind of technical subject, for example, if someone has taken civil engineering, then what he aims something like Indian Engineering Services also, along with this UPSC. So when someone prepare for UPSC with medical science as an optional, will it help in other of the examination?
Sir, it might help in some of the other examinations, like the UPSC examination. Some of my friends had cleared the examination, which is for the medical officer. It can help because a part of GS or current affairs comes there as well, and the optional that we are preparing, many of the answers can be covered there, and in the interview itself, it is beneficial. Yeah, so in some of the exams, it can be beneficial for sure.
Okay, okay. So if someone takes medical science, then he can also target this combined medical services of UPSC. Then we have state services also. So this is also a benefit of this medical science as an option, right?
Yes, sir. It has.
Okay, fine.
And in fact, there is a fallback system as well. If the person is preparing medical science thoroughly, at least a part of the area would be covered, which can be utilized in the other examinations, like NEET examination. If a person wants to go for PG examination, unfortunately, if he's not able to clear this exam, that was also one of the things that had relieved some of my pressure. So my strategy was, if I'm not able to clear this examination, eventually keeping medical science as my optional would help me in staying connected with my medical field, so that I can eventually go back to the medical profession and go for postgrad.
Right. That is also the logic with lawyers. Lawyers also prepare with this logic only, that if they fail, they will enhance their knowledge in the practice.
Yes, sir.
Fine. Asrar, tell me one thing. Is there any much role of test series in this medical science optional? Test series, the role of test series?
Sir, I haven't taken any test series. I don't think there is a large role. Only 1 or 2 test series are available online, and the checking is not up to the mark. So I would recommend not to go for the test series. Rather, write the answers, go have a look at the previous year question papers that are there, prepare answers for them, and get it evaluated by any other person who is also preparing for medical science option. That would be more beneficial rather than going for a test series, which is not up to the mark.
Okay, so if the syllabus is so static and the paper is not so dynamic, then I think that the previous year papers, they would help a lot in this paper, right?
They surely do, sir. Many of the questions are repeated in medical science. So if a person is preparing, he will also get insights into the kind of questions that are prepared. And moreover, some of the topics are also prepared by having a look at the other previous year question papers. And that also helps in the attempt itself.
Okay. Asrar, nowadays coronavirus is going on, COVID-19 is going on, and there are so much news on this COVID-19. So such kind of things, if it will influence UPSC, this medical science option, then what? Can you just explain one question to me that this can be an expected question in medical science?
Sir, some of the questions usually are there from the science and technology background. Last year also there was one question on hepatitis B. So few questions that can be asked are some of the tests that are being done, like some of the questions from the coronavirus itself, like the structure of it, glycoprotein of it, some of the questions pertaining to that, and some of the questions pertaining to the tests that are being done, like RT-PCR or antigen test or antibody test, which of these can be helpful in seroprevalence, etc. So these are some of the basic things. However, I don't think they will go into much details when it comes to corona.
Okay, so though the syllabus is static, there might be some influence from the current news and all. Fine.
Yes, sir.
Yeah, fine. And Asra, tell me one thing. Lot of people they ask me on Quora itself that we are in MBBS and all. So what should we do in the next 5 years if you want to prepare for UPSC? And they always say that we are not getting much time in the college. So what basic minimum thing that they can do for this UPSC?
Sir, MBBS needs a lot of hard work even to clear the examination, the yearly examination. So I would recommend most of the people to prepare well for their graduation, for the final exams themselves. But one thing is that they can do is keep the optional subject syllabus with them, and the topics that are there in the optional subject, whenever they are covering the optional subject, the subjects that they are preparing, prepare those topics very well and make notes out of them. That is going to be very beneficial when they appear for the exam, especially in the mains examination. And side by side, have a look at the current affairs, have a look at the newspaper daily or if or weekly, etc. And have a look at some of the current affair magazines that are available, monthly magazines. That will help them in having some of the knowledge about the current affairs, and will also make their the optional subject strong. And rest of the things, I think that can be covered in their internship or after the internship.
So the crux is that if the students they are in MBBS college, the schedule is quite hectic, and so if they take medical science as an option, then as if they can behave as if they are preparing for UPSC itself while they're in the MBBS, right?
Yes, sir. So in fact, I would say one thing from my own experience. When I was doing my internship, I tried to read newspaper daily, even when I was in my in emergencies. I used to take out the newspaper whenever no patient was there for 5 or 10 minutes. I used to read 1 or 2 news items. So that was something which helped me preparing the current affairs. However, I focused more on GS portion and I left the optional subject during my internship, which I think was a mistake. During the internship, if you are posted in surgery, the department, it is better to revise the surgery portion that would be there in the optional subject. That is going to be beneficial in the mains examination, and immediately after the internship, you start preparing well journals.
Okay. Asrar, any tips for the medical students for CSAT? Because there is a phobia of CSAT among the doctors I've seen.
Yes, sir. Sir, CSAT is something which needs a little bit of practice. What happens to people is, many of the people, they think that they would be able to easily clear this examination, the CSAT exam, and for the first time when they appear for the prelims, they start attempting the questions, and they're not able to attempt some of the questions, like the quant questions and the assumption questions. So my suggestion would be to go through the previous year question papers, 5 or 6 year question papers, and solve those questions thoroughly. And if they have any difficulty with some sort of maths questions or etc., they can go for any standard book. But the most important thing would be monthly or once a month or twice a month, they can attempt one of the CSAT question, previous year question papers. I think that would be more than sufficient for them.
Okay. Asrar, have you seen the syllabus of state PCS of Kashmir?
Yes, sir. I had, in fact, appeared for the preliminary examination.
Okay, fine. Then you are the right candidate. Then you are the right candidate for this question. I just want to know how a person who is preparing for UPSC specifically, he can prepare for state PCS of Kashmir also simultaneously.
Yes, sir. Sir, I had not planned of giving the state examination initially. My main focus was on UPSC only. However, when I could not clear the first 2 attempts, so that was something I would suggest to focus mainly on UPSC in your initial attempts and try to clear it as soon as possible. However, if unfortunately you are not able to clear, that can be the state PCS can be one of the options. So now in our state, in our union territory, the syllabus is same as that of UPSC, exactly same for prelims and mains. So people do not have to read anything else, just little bit extra regarding the Jammu and Kashmir history, etc. So strategy should be same, but I think UPSC should be priority. What I did was I cleared the preliminary examination of my state exam, and then the mains examination for KAS, Kashmir Administrative Service, was in July 2019. So I would have to compromise the UPSC mains examination. So I left the mains examination of state services and I focused on UPSC, and that was helpful in the end. So priority should be UPSC. However, state service should be a fallback option. So sir, I'm not able to hear you.
So it's a good news that Kashmir has now made the syllabus at par with the UPSC. So it will be very helpful to the students.
Yes, sir, it will be.
So Asrar, we have taken a lot of questions from you. The last question and the last tips from you to the people who are appearing for UPSC Prelims 2020 on 4th of October, what they should do in the next 1 month.
Sir, my suggestion would be not to cover any new topic this time. Whatever you have covered, that would be more than sufficient. Just try to revise the already covered syllabus as much as possible. Focus should be now on the static portion. Some of the subjects which are very important, like the modern history portion, environment portion, the polity portion, and current affairs of last 1 year. These should be priority, and other things can be revised. However, rather than going for the new topics, better revise whatever you have covered. And be confident. That is very important. I have suffered in my previous attempt because of this.
Okay, Dr. Asrar Ahmad, thank you very much for joining us. And from the entire team of JS Score, we wish you all the best. And probably you're going to be an IPS officer, and you will be a doctor also, an IPS officer also, and such officers are in need of time for the country. And thank you very much for joining, Asrar.
Thank you very much, sir.